Well,
but it can help some things.
I can tell you another thing a lot of people don't realize is if you're depressed, vitamin D, if the levels are too low, can really make your mood suffer.
Really foul you up, huh?
It can. And, I worked on psych units for years, and that's one of the first things we always checked in people was their vitamin D level, because if it's 5, it needs to be 30 or higher. If it's 5, then you're going to be probably not feeling all that great, and it's very easy to fix it. So you're right. There are certain cases where something as simple as a vitamin D test can change your life. The problem is most doctors won't run it unless you ask them. And the insurance companies don't like to pay for it, which is, in my mind, crazy. But
something so cheap and simple that you can just take. You don't have to get some injectable or something. It's literally the easiest thing in the world.
Yep.
Insurance companies don't want to pay for it, huh?
Nope. Depends on your insurance, I guess. But
depends on your
mine
insurance.
doesn't want to. I'm willing to pony up the money for it though, because I know how important it is. So
yeah. No, and it's not super expensive, right? Did you take that mega dose at once a week or something like that?
No, I just took a regular vitamin D.
Just straight off the shelf, huh?
Yep.
Yeah.
I mean, I make sure it's a quality one. I don't just grab the cheapest thing at Walmart for sure, but
you make sure it's USP certified and all that. It's not some.
Make sure it's produced in a good manufacturing practices lab. And
no, at where I did my PhD at the University of Texas, they had a geroscience department, and one of the best in the world, if I may say so myself.
Oh, wow.
But, anyway, no, we got more funding than almost anybody. But anyway, no, they would do studies on seniors, and they would do their blood work, and the resident physician there would basically said 90% of seniors have vitamin D deficiency.
I believe that's true.
So it's very, very common, and
and that's in Texas.
That's think about it's sunny all day, every day. Well, sometimes it's too sunny, so I think that might be.
Think about Oregon. I'm in Oregon. There's no sun during the winter, hardly ever.
Yeah. So get your vitamin D levels checked, everyone, especially if you're a homebody or you're a little bit too afraid of the sun,
or you don't feel all that great. If your mood's suffering, that's the first thing I tell people to check.
That's great advice. That's something that, I'm indoors quite a bit. I try and do like a 30-minute run every day, but out in the sun on my lunch break. But other than that, I'm pretty much indoors sciencing things. So besides vitamin D, what are some nootropics you might recommend? Like the individual ingredients mostly is what I'm interested in.
Well, the big one's caffeine. Right. I mean, that's the one that's been around forever. Caffeine. I mean, it's what everybody uses to stay awake, be more focused. I will tell you a trick, though. You got to be careful with caffeine because it can make you jittery. It can cause anxiety. If you're somebody who's prone to panic attack, it's not great. Right.
Yeah.
If you mix it with L-theanine, you can get rid of a lot of that jitteriness and problem areas,
smooth it out a bit.
And I'll tell you another trick. And I tell my followers this, especially ones that are trying to lose weight. One of the best things that you can drink during the day is green tea, because green tea not only has caffeine in it, but it also has L-theanine in it, and it's full of antioxidants. So you're getting 3 different things that really can help you. Now, coffee's got antioxidants in it too, but that L-theanine does make a difference, and it can help you just be more awake, be more alert, and you get that antioxidant boost, which you talked about oxidative stress earlier. That's important.
Yeah.